Hi, welcome. You'll forgive me if this is a bit quick. With the power outage and the storms, we're back to paper charts. A lot of fun, but we have this going a bit like frankly, an assembly line. I'm here to get your basic information and some history before I return this to the next physician who will be getting more information about your current situation. So, just lots of questions. If you don't know the answers, that's fine. We are going quite a bit by, well, very much by checklist. Takes a lot of the guesswork out of it while we don't have our technology to depend on. Pros and cons. Anyway, enough rambling from me. Let's get started. Your full name, please. And your date of birth. Great. Why they have your date of birth and your age simultaneously is a little insulting. We can do math. You don't happen to know your medical record number off the top of your head, do you? That's okay. I didn't expect you to, but sometimes we get lucky. Moving on. Any allergies? Penicillin, okay. And what happens to you when you take penicillin? You don't remember? It's fine. Did it happen to you when you were a child, really young, and your parents told you were allergic to penicillin? Just for the future. Probably not a true allergy, but you never know. I wouldn't just go take penicillin just for fun. Any other allergies? None. Great. Any medications you take? None. Great. Any of these health maintenance screenings that you've had done recently? Last cholesterol was checked. Hemoglobin A1C. Any blood work done recently? None. Okay. Do you recall the last time you had a tetanus shot? Yeah, well, with the storms as they are, you never know what kind of metal gets thrown about. You know, off the top of my head, I don't recall if you need one for college. Usually that happens in the pediatrician's office, and I only treat adults. Something worth checking on. If not, just for basic general health purposes. Okay. Do your personal medical history section. Any history of alcoholism or drug abuse? None. Okay. Asthma? Any cancers in the past? Just for you, not family history. Okay. Any problems with mental health, depression, anxiety, bipolar? Okay. Diabetes? COPD? Any history of heart disease? High blood pressure? No. Okay. High cholesterol? And any thyroid disease? Any kidney disease? Any history of migraine headaches? How often? Kind of when you were a kid and through your 20s grew out. Oh, okay. Do you remember the last time you had a migraine? Proper migraine, yeah, like useless for 24 hours kind of a migraine, yeah. 26, okay. Any history of stroke? Okay. Any other medical history that I've missed? Any surgeries? Appendix. Appendectomy. Do you recall how many years ago that was? All right. Moving on to family history. Any family history of alcohol or drug abuse? None. Good. Asthma. Cancer. Grandmother, mom's side or dad's side? Dad's side, okay. Do you know what kind of cancer? No, okay. COPD or emphysema? None, good. Any mental health problems in the family? Good. Diabetes? Mom's mom with type 2 diabetes, okay. Any history of early or sudden death? Good. High cholesterol, high blood pressure? Dad and dad's dad, okay. Both? Okay. Kidney disease in anybody in your family? No, okay. Anyone with a stroke? And thyroid disease? Fantastic. Do you work or go to school? Where? If you don't mind me asking. Okay. Your highest level of education? It's almost kind of pointless for medical, but it actually helps when we're, for example, if you have a PhD in molecular biology, I explain things differently than if you have a high school diploma, right? There are more intricacies that I can get into that I know you will either understand or tell me that you don't understand, and we can kind of take it from there, versus someone with a high school education may not have been exposed to those kind of higher level medical terms, right? So it helps trying to reach the patient at the patient's level as opposed to just me talking over everyone. Sorry, tangent. Marital status. Okay. And any kids? Okay. All right. Other health history we have here. Any tobacco use? Previous. Okay. And how long has it been since you've quit? Fantastic. If you had to guess, how many packs per day? Oh, okay. And for how long did you do that? Okay. Fantastic. Any other tobacco? Okay. Any alcohol? About how many drinks per week would you say? Okay. Any recreational drug use? Not currently, not ever. Fantastic. All right. Do you exercise regularly? What kind do you do? Right. And about how often? We like that. How many hours of sleep do you get every night? Not enough is the most common answer I think I've ever had in my life. And how would you rate your diet? Good, fair, poor? Good, okay. All right. Do you have any doctors that you see regularly? Just in case we need some records or we know where to send the records. None, okay. All right. We'll go through. Oops. Dropped your paper. Sorry, I get that minute. We'll go through your review of systems, and that'll be it. So, a lot of specific questions, so bear with me. It's either yes or no. Constitutionally, any changes to your appetite? Okay. Any changes to your activity level? Any chills? Unexplained sweating? Unexplained fatigue? Fatigue, yes, but unexplained because you can't sleep. That's explained. Any fevers? Unexpected weight change? Okay. Any congestion? Ear pain or discharge? Okay. Any swelling to the face? Hearing loss? Mouth sores? Nosebleeds? Runny nose? A little bit, okay. Is that post-nasal drip kind of dripping down the back of your throat? Kind of everywhere, okay. Pressure in your sinuses? Okay. Sneezing, sore throat? Any ringing in the ears? Okay. Trouble swallowing? And voice change? A little bit because of the post-nasal drip, okay. Any eye pain, eye discharge, itchy eyes, dry eyes, redness? I look a little bit red. Tough to tell if that's sleeping issues or not. Any issues with bright lights? I know, I'm sorry. Oh, good, okay. And then changes to your vision? No, good. Any chest tightness or trouble breathing? Are you coughing? Yeah, okay. Difficulty catching your breath, shortness of breath? Okay. And any wheezing that you've noticed? Okay. Any chest pain? Leg swelling? Do you feel like any palpitations or that your heart is fluttering? Okay, good. Any belly pain? Okay. Nausea, vomiting, diarrhea, constipation? Nothing. Okay. Any cold or heat intolerance? Okay. Do you feel like you're more thirsty than you should be? Do you feel like you're going to the bathroom more than you should? Okay. Do you feel constantly hungry? Okay. Any issues going to the bathroom? No. Okay. Muscle pain? Yeah, where? Kind of everywhere. Okay. Any sharp back pain? No. Okay. Any issues walking? Notice any swelling of the joints? Any of them, really? No. Okay. Neck pain, stiffness? Stiff neck? How long has that been going on? Just since this morning when you woke up. Okay. Any changes to your skin that you've noticed? Rashes, color changes? No. Okay. Any dizziness? Currently having headaches? No. Okay. Currently lightheaded? Any numbness and tingling anywhere? I will put down no difficulty speaking. Tremors? Good. Have you passed out, lost consciousness, had a syncopal event, and generalized weakness. Just a few left. Have you noticed that your lymph nodes are swollen? Yeah, kind of under here. That's what I figured. And then have you noticed that you have been bruising easily or bleeding easily? Like when you brush your teeth, you just bleed a ton? No. Okay. Good. Any disturbances to your sleep? Other than not getting enough and not being able to fall asleep. I certainly understand. But you don't wake up in the middle of the night. Okay, good. Do you feel nervous or anxious? Not more than normal, okay. Alright. Abnormal confusion. Alright. Depression? Nope. Okay, good. Alright. Any feeling of your mood is too good to be true? Okay. Have you ever had any situations where that's happened? Okay, good. Alrighty then. Great. I've got all this down. I will get it to the next doctor, who will be kind of checking you out with a more focused physical exam, and after we talk, and hopefully you get out of here, and hopefully you also didn't lose power.